Hi, this is Lynn DeVore, and you've reached my personal introduction, Nursing Informatics, Nurse 561, Module 1. Again, my name is Lynn DeVore. I received my BSN at Mesa State College in Grand Junction, Colorado in 2005. I was born and raised in Laramie, Wyoming. I currently reside in Seattle, Washington with my husband and rescue pup. I am currently on the psychiatric mental health nurse practitioner track at Gonzaga University, and I started fall of 2017, and I'm in it for the long haul in 2020. And I like to keep busy. I do have two part-time jobs, and eventually something I'll have to give. But for now, I am a IVF weekend nurse supervisor at a fertility clinic in Seattle, Washington, and also a psychiatric nurse at a residential eating disorder treatment facility in Bellevue, Washington. Why Gonzaga? Why not? Really, it was the convenience of online courses, the ability to work at my own pace, having similar core values, the servant leadership, social justice, and valuing the community, the humanistic model. I also value combining critical thinking with compassionate care to treat the whole patient. The reputation of Gonzaga is phenomenal. We have had many new hires come from Gonzaga, and they all have come exceptionally prepared. And the cost. It's not free, but it is competitive. And why now? I do see a desperate need for mental health care providers in the Seattle area. There's a high rate of untreated mental health disorders leading to drug abuse and homelessness. And also there's a need for maintaining health and wellness. There's a desperate need for high quality, cost effective care. And in my career, I'm ready for more. I've had my BSN for 13 years now, and I've always seen having my BSN as a stepping stone. So I am ready for more. Feelings on technology and data management. One of the first feelings that comes to mind is feeling empowered. Being able to use real-time data to collectively interpret information and having the ability to immediately speak to a patient's needs or concerns. Continuity of care, it really does lead to comprehensive, high-quality care and excellent patient satisfaction. Comprehensive patient education, again, I can speak to the current needs and educate the patient with where they are at in their treatment cycle. And clear orders if it's used appropriately. There is a reduction of adverse events or medical errors. Other feelings would be frustration, system failures, systems going offline, power outages, user failure or failure to use, lack of system or program standardization. The book speaks to virtual database silos where there's no true interface between the pharmacy, laboratory, care provider, or hospital EMRs, and that leads to redundant patient data entry. Also feeling overwhelmed. The EMRs I've worked with are usually not intuitive or user-friendly. They're time-consuming. The data entry of outside records is very time-consuming. There are also additional keystrokes for a simple chart note. And also the large volume of data to review. That data is often in different areas of the patient's EMR. So it takes time to really pull all of that data together. Nursing informatics in reproductive medicine. We tend to follow the nursing informatics model that's mentioned in Chapter 16. On a daily basis, we're taking data from patients' lab results, including estradiol, follicle-stimulating hormone, luteinizing hormone, anti-Müllerian hormone, progesterone levels, and also follicular ultrasounds. We take that information, the data is collected, and it's combined with the type of treatment cycle they're in and the day of stimulation that they are on. The knowledge, information is synthesized and interpreted with use of reflection and experienced nursing knowledge. And wisdom comes from the patterns that are identified. And there's a determination of immediate action if it needs to be taken or not. So my example is once we look at the lab work, look at the type of treatment cycle, the ultrasound, where are they at in their treatment cycle? What day of stimulation are they on? It's possible that they may need an immediate antagonist injection to prevent ovulation during the treatment cycle. And it's really pulling all of that data together and knowing when you need to grab a physician and say, hey, I need you to look at this right now. We may need to have her take an antagonist injection. So that is one way that we utilize nursing informatics model in our daily practice. And evidence-based practice, we use secondary data and aggregated data. We crunch that. They use this data to analyze cycle responses, and this helps providers develop or enhance treatment protocols if they can look at a group of patients that have gone through the similar treatment cycles, what worked, what didn't, and with that, they're able to enhance treatment protocols. Also, we analyze outcomes in live births. All of these are reported to the Society for Assisted Reproductive Technology, or SART. This is a national database that holds statistics on individual clinic success rates. So I always tell patients, friends, family, anyone interested in doing fertility treatment, they should go to SART online and really check out individual clinics and see what those clinic success rates are before starting treatment there. And pulling it all together, in this course, I'm actually looking forward to expanding my technical and data management skills, learning more about the advanced practice role of nursing informatics, and also easing my technology fears and placing my frustrations to rest. And these are my references. Thank you very much. I look forward to working with all of you during this course. Thank you, and have a great evening.